everyone. This is Mark East with the State Medical Association. I want to welcome you to this webinar this afternoon. Before I turn it over to Stacy to introduce our speaker, just want to remind everybody that we're going to keep the phone lines open. There's a background noise, though I will mute the line so we can try and not have any distractions for our speaker. If you do have the capability, please go ahead and mute your phone. But again, we like to keep them open so when there are opportunities to ask questions, you can do that. With that, Stacy, I'll go ahead and turn it over to you.
Good afternoon. As Mark said, my name is Stacy Fredenberg, and I'm the Communications Manager with the South Dakota Foundation for Medical Care. As part of the Great Plains Quality Innovation Network, we're excited to be partnering with the South Dakota State Medical Association to offer a 10-part series of webinar briefs. Key patient-centered care topics will be presented in 15 to 20-minute webinar segments, highlighting provider and clinician perspectives while introducing corresponding resources and tools. Today, Quality Equals Financial Success focus on relating patient-centered care with administrative priorities. Along the challenge of altering the acute care culture of Americans to a culture of prevention, health professionals must navigate the change to value-based payment. So I'd like to introduce our speaker, Holly Ahrens. Holly is a patient and has a strong passion for assisting rural and frontier provider practices. She has a 20-year career in healthcare and has built her skill set from several different areas of the healthcare community. Manager for the Great Plains Quality Innovation Network, her expertise is primarily focused on quality work around cardiac health, quality payment programs, and large-scale transformation through the Transforming Clinical Practice Initiative. Thank you for sharing your knowledge and expertise with us today. I'll turn the presentation over to you.
And thank you, Mark, for having us and all for attending. And today we're just going to do a quick review of how that transition into the value-based reimbursement system. And the way that is to focus on how your quality measures are performing. What that does is your performance scores are going to equate into dollars, basically. And to give just an overview of how that is done and what dollars will look like. So we're going to do a review of a tool that the Great Plains Quality Innovation Network has put together. And what it is, it shows you what your performance would equal into dollars in the reimbursement cycle for 2019, which is based on your 2017 performance scores. So let's get it. I have a state of physician, which you probably already know. You could probably give it to me. But on the left-hand side, we know that you have onerous administrative burdens on you. You're facing lower reimbursement, you're facing malpractice premiums, and we've seen in several surveys that there is decreased satisfaction with your physician. And now you know at the Great Plains Twin that you care about and for your patients, that you feel responsible for the staff that work for you. You're sure of the solution of what's going to make this work in terms of reimbursement and business model, area of care. I know many things come and go from capitated and HMOs and all of those. And you maintain that art and science in the practice of medicine. So understand the situation that you're in, and Medicare put us into place to provide assistance and trying to be successful in the CMS program. Of moving to a value-based system on your side, when we're talking about the quality measures, is really your ability to articulate the quality of care that you're providing. So really providing data from your systems that tell the story of your quality care. Now that is being able to efficiently and comprehensively collect data, monitor your measure performance. When you have data, then to be able to make improvements, whether that's in your clinical documentation, in your clinical workflows, of data, reporting of data. You need to be able to report that data in a feedback system, and then also to be able to report it to CMS to ensure that you're complying with the program requirements. and that's what would be get paid, and hopefully to have a positive payment adjustment and potentially an additional bonus on your reimbursement. So let's see. The requirement to have technology that is certified. So that is that certified EHR technology. You will hear it called CERT. The standards and certification practices that have been established for EHRs, and you must ensure that you have a certified product. That product integrated into it, or a analytic technology you have that has electronic clinical quality measures into it, so it can filter through data, measures that we're looking at, to that it can pull the correct data to give you performance scores. Also, the feedback system that has two goals. One is to provide you feedback of your own performance, and then also to be able to report to CMS. Next is very important, and we have a slide on this, for you to be involved in measure selection. Your patients, and the thing that I think many physicians maybe are not in, whether it is because you're in a larger network where they choose measures that are reported for you, or that having a office manager or your quality person to select those for you. So we're going to get that a little bit. And then also collecting data is in clinical workflows that you have the right person collect data, you have any information into the correct areas of your technology to ensure that that data is then filtered through those eCQMs. One of the ways to report for the 2017 MIPS participation is through Qualified Data Registry. Now, this is one of those options that you can have, and one of the options are that you can submit via claims, you could submit via your EHR, you use a data registry. Now, if you are in a practice that possibly does not have an electronic health record, this is one option that you could use. So, having an EHR is no longer one of those things that will keep you from participation. What a registry is able to do is that it can consume in many different ways. There are put through claims, so you can have it talk to your practice system. It can talk to EHR if you don't have the ability to have reports generated out of your EHR. And also you can manually enter data if you are still on potential manual chart audits where your quality people are collecting that data through a sampling. So it is those form data. It will give feedback on those measures that you have selected and make adjustments and workflows, just as we had discussed. And then also submit your data to the quality payment program for you, so then you can participate successfully into that program. That's one of the strategies that can be used to participate in the program. So here's my, as I said, it's really, I believe, for physicians to participate in this process. There currently are 271 measures that you can select. This will change depending on the submission type. So if you do choose a Qualified Data Registry, the list of measures is different than if you chose EHR submission or claims submission. So for that list of measures, and then looking at that list, and obviously there are specialty measures that you could select from that give you data back about patients and the interventions and outcomes that they are showing. You know the patients that you see, the interventions you're using, you know what medications that you use, and any evidence-based guidelines from which you work. The scores you will be reported publicly on the CMS Physician Compare website. So there is reputational skin in the game here that you want to ensure that you're showing the best light you can about yourself. So if in a practice that does have the ability to select, would recommend that you become part of that process. So now we're going to monitoring, and this is really about taking those performance scores and ensuring that you have a way to what your scores are. And at Plains Quinn, as I said, we have provided a tool called our MIPS calculator. Now, don't be scared of this and everything, but take the three categories in MIPS that add your total score, which then will determine what your reimbursements will be in 2015. So I took through this, and this is a sample of a primary care provider. And what we do, take the number of clinicians here. So this sample is we have 5 eligible clinicians or 5 clinicians in this practice. Here's a Part B for a year, and this can be an estimate or it can be last year's total charges. Put in there. And if you're in a health shortage area, you can mark that here, which changes the point scores that you would be looking at. As these 4 categories: quality, advancing care information, improvement activities, and cost. So 17 cost will not be part of your total score, so that is set at 0. The weight is 60%, ACI is 25, improvement activities is 15. So here, with these 3 categories that we've looked at, so we created different tabs in this calculator, and I'm going to go to our quality tab first. I'm going to set this a little bit so we can see a little bit better. We created a calculator here that you can select your measures that you're going to be working on, and you have to submit 6 for 2017. Cloud that you can put in up to 12, so that you see which measures will be the best in terms of submitting for the CP 2000 participation. So you see some measures here. These are primary care focused. I've got the A1C, influenza, pneumococcal vaccine, breast cancer, documentation of current meds in the record, tobacco screening, pressure, and then screening for high blood pressure and follow-up documented. Calculator, we've identified if it is a high priority or outcome measure, because you are required to report 1 outcome measure or high priority if an outcome is not available. Use the mission type you're going to use, so be it claims, EHR, or qualified data registry. So we'll change the benchmarks and also the point scores. And then what is your performance rate? So on hemoglobin A1C, a particular group is at 65%, and we do this for group or individual. And I change this, you can see that a 65% score, 2 points here, and the full 10 points, you would have to have a 0%. This is an inverted measure, so lower score is better. So we've put in formulas that CMS had given of how they are going to be scoring off of these deciles, and then I'll giving you an idea need to be to get the full points. I want this particular one here. This is documentation of current meds in the record, and you can score 92.56. This is a really good score, you would think, if you were looking at graphs and charts. Say, wow, we're doing almost 83%. That's a good score. But in terms of this measure, you're only getting close to 5 points. And the reason why is because this measure is topped out. And that means that it has the average for the nation of providers has been scoring very well. So to get the 10 points, you would have to be 99.76. So we can change this score, and you can see once you would get the 10 points. that's what the calculator does. It does show you if you are scoring, your 4.96 because that's a topped-out measure. It does if you have more than 6 measures in your list here. I will tell you which ones are the best measures for you to submit of where you're going to get the best scoring. There's 2 measures here, this diabetes and the high blood pressure, that are dark grayed out. They're just telling you that you shouldn't report on these because you have lower point scores versus others. Okay, so it really benefit. Say we move this up to 95%, you can now changes that your documentation of current meds is not the optimal measure to report, but now to report that controlling high blood pressure because you're at 95% and you've gotten 10 points in that. So we think the value that providers, it kind of simplifies some of the complexity of how to understand which measures to report. And for providers that we're working with is we collect their data either on a monthly or quarterly basis of their scores, and we populate this calculate, provide that back to them, and just have discussions about, make an improvement to get the highest amount of scoring. So then we'll see, so we've done our quality measures, the weight is 60. So the points that are allowable, so this person has achieved 50.25, reporting EHRX, so I put in 6 measures there that we're reporting. And I got a bonus of 3 points because I had 3 high priority measures. So the score here is 59.25 out of 60, which is a relatively good performance. So advancing care information, essentially the same type of thing. There are sets of measures that you could report on for advancing care information for 2017, and it's all based on the technology that you have. So if you have a 2014 certified product, use this. If you had 15, use this group of measures. So say this group has 2014. Again, for data, we enter in the numerators and denominators in these measures. This is the base measure you have to meet to get any points out of high category. And then optional measures, so we put those in as well. Here, the score for advancing care information, the base score out of 50, they got 50 points. The performance score out of 90 was 58, and they got a bonus of 10, so achieved the 25% points here. Activities, these are really based on patient-centered medical home and coordinated care. It's about access, participating in being accredited, participating with the Quinn, participating in Transform Clinical Practice initiatives. You can choose up to 4 that you would like, and you'll get scores just by saying yes or no. So it's really just an attestation. And high weighted in 1 medium if you're not in a health area. If you are in health shortage, it's just 1 high weighted or 2 mediums. So we've clicked here and gotten that we 2 weighted and 1 medium weighted, so we achieved the 15 points. Now this is interesting because we now this score of 99.25, and you can got 4 years of the program. Here we are in 2017. Our general payment adjustment year is 2019. Right now, neutral score is 3. So if you score a 3, you're going to avoid a penalty at this point. If you went to the bonuses or additional monies, you have to score 70 and above. If you wanted to set goals to say, we're going to improve by 2 points every year, you can do that as well. So in there. Final score of 99.25 right here. So percent, and you can see over 4 years what the regulation is indicated is that it's going to be a plus or minus of 4 for 2019. In 2021 is 7%, and 2022 is a plus or minus 9%. So right, based on this 99.25 score, this practice achieved the 4%, and they have an additional bonus of 9.76. So we're at a 13.76 reimbursement increase. So we've taken that based on the chart that they had indicated, and that was up here, top here. Go back. So they 0.5 million in charges, part charges. So they this is just breaking it down over the 4 years, and we could see that your base at 4% would be a $60 increase, and then additional is $146,000 some change. So we take that over the 4 years and say, you know what, before MIPS in 4 years you don't earn $6 million, and then MIPS estimate, and that's just the base, it's $6,375, and if you have MIPS and your additional bonus, you're close to $7 million. So it's $1 million difference participation. And it's really important to identify how much the quality scores do affect your reimbursement. For clinician, if you'd like to see it that way as well. Well, is basically said for 2019, and you can change this here to see where you fall in reimbursement. Right now, it's at 3. You can see right here. So as your score increases, obviously the reimbursement increases. See that it changes directly. For 20, so got it about 56. Where it will be, and scoring, will be correlated to score there. Okay. Our presentation now. I'm going to ensure that we get all the slides in our time here. So when you're looking at participating in the quality payment program, I think the one goal that you must set for your practice or yourself is that we are going to achieve that 4% base payment. Now, there's to do that, you can, you just test participate submitting one measure quality or the base in ACI or one measure in improvement activity. So that's very easy to avoid the penalty. But into that 4% base payment, you are going to have to participate and measure. So setting that aim, saying to the practice, you know what, we'd like to that 4%. Anything that is additional, we're going to just, make gravy, or we may set some real goals there that we'd like to achieve a 2% additional bonus, and potentially look at what that equals in dollars, because dollars for different technology, bringing on another PA or a nurse practitioner, bringing on, another member. So changing mindset from avoiding a penalty or trying to not participate, really getting paid for the care that you are providing, because right now, way to show that other than you just standing and saying, yes, I know my patients are better for the interventions and treatment that I provide them. This is the way to do it, and for you then to get paid for the quality care that you're providing. So to assist you, one of the benefits of being a Medicare provider is that you are provided free help, participate and be successful in these SNES programs. So we have a quality payment program service center where you or your staff can log in, and experts from across our network, which is Kansas, Nebraska, North and South Dakota, we're there Monday through Friday from 8 to 4, and you can chat or you can call in there's the phone number there. You can directly or access my email there, and I'll provide on-site assistance for you there. Any questions? I'm going to pull the chat screen here.
Oh, mute a couple lines. We're picking up some background noise, but all phone lines should be open at this time. So one question I'll ask is, under the tool, how can somebody go about getting the tool or accessing that and starting to plug in their information and seeing where they're at?
Yeah, go ahead and give me a call or an email, and we'll go ahead and forward it on to you. Have it for public use. We share it within our participating clients, and then also through the QuinnQI community across the nation. So, you know, we don't available out on the website, but I gladly will send it off to you if you contact me.
Thank you.
One thing that I should probably show is we do reports that you can generate out of the calculator that basically shows all of the information in one nice printable report. So here's your quality category, gives you your points, tells you one of the things is you're submitting one top-down measure, but it tells you that you've participated and completed all requirements in each one of the categories, and information about those regulations that we have shown on the first page. I want to make sure I showed that as well. Well, I don't see any questions out there. Did Stacey or Mark, did you see that I may have missed?
I don't see any out there at this time.
All right, well, my contact information, and I appreciate again Medical Ocean for hosting us, and I hope you have a wonderful day.
And I just wanted to remind everyone that the next webinar in the Provider Perspectives on Patient-Centered Care is titled Patient-Centered Equals Quality, and it will be held at 12:15 again on June 20th. And so, as Holly said, there are additional information, tools, and resources, quality reporting and improvement on our website at plainsquinn.org. We appreciate your time and participation. Please take a final moment to complete the webinar evaluation when you exit the system. Thank you and enjoy your day.
Thank you.